like to call to order the Chi-Li Town Board meeting for August 13th, 2025. Would everyone please rise and join us for the invocation and Pledge of Allegiance.
Heavenly Father, we come before you with gratitude for the blessings you have bestowed upon this nation. Thank you for the freedoms we enjoy as Americans and for the privilege of gathering here this evening. We humbly ask for your wisdom and guidance to rest upon all who are present. May our discussions be marked with clarity and fairness. We lift up to you the needs of our agricultural community, those whose labor sustains our food supply. We pray for favorable weather, protection for the crops, and a bountiful harvest. We also ask your blessings upon those who are traveling for rest and renewal. Grant them safety in their journeys and refreshment for their minds and bodies. We thank you for the beauty of this land and the countless opportunities it offers to witness and enjoy your creation. Amen.
Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Councilman DeCory?
Here.
Councilwoman Spare?
Here.
Councilman Valerio is absent. Councilman Slattery?
Here.
And Supervisor Dunn.
Here. Other officials and advisors present this evening. To my, where am I going? To my far right, Town Clerk Jenny Ignatowski. Also to my right, Deputy Town Supervisor Councilman Michael Slattery. At my far left, Councilor for the town this evening is Jeffrey Albanese. Thank you, Jeffrey, for joining us.
You're overdressed.
Hopefully we'll make this easy on you.
Oh, I'm sure it's fine.
At the side table, we have Commissioner of Public Works, Superintendent of Highways, David Lindsay, and from my office, Don Forte. Our stenographer is Sandy Hewitt. In event of emergency, if you would please use the exits to the corner of the room, and at this time, anyone with a cell phone, if you please either turn it off or set it to vibrate, we'd appreciate it. So we do have a presentation this evening from U of R Medicine Mobile Stroke Unit. I guess I'm going to ask Jason Burgett to step up and do you want, there's a clicker for this, your slides. I'll let you take control. I'm really bad at that, so, and you know where you're going, I'm not. We all should be able to have it up on your screens, correct?
Yeah.
Okay, so we can see this from our seats here.
Good evening. I appreciate the opportunity to come out and share with you all an opportunity that exists in Monroe County from the University of Rochester Medical Center. It's the Mobile Stroke Unit. Without further ado, I'll just jump into what I have prepared and give you the information that we can share with you here. So we're going to look quickly at what a stroke is. We're going to look at the MSU concept. We're going to talk about how it's dispatched in Monroe County, and then any potential benefits for your community. There's a little bit of a caveat that we'll get to at the end of the discussion with that. So basically, a stroke is a disruption of blood flow to the brain, and it results in death of brain cells. The signs of a stroke, as you may or may not know, are what we call a mnemonic of be fast. It involves oftentimes balance issues, eye vision changes, double vision, field cuts in the visual field, a face weakness, usually unilateral. One side of the face looks like it's drooping compared to the other side. Arm and leg weakness, typically unilateral as well on one side of the body. Difficulty with speech, either slurring of words or actually not being able to speak correctly using inappropriate words. And if you see somebody that had a sudden onset of those types of symptoms that were like you and I just a few minutes ago, then it's time to call 911 because time is of the essence when it comes to intervening on strokes. Stroke is a bad condition. It's the 5th or 6th leading cause of death in the United States, the 3rd leading cause of death in Monroe County. It's also the leading cause of disability in the country. More people end up in long-term care facilities and skilled nursing facilities for a long period of time, the rest of their life in essence, because of the devastating impact of stroke. That they're no longer able to have independence and they're dependent upon others for care, and it's a bad thing. And the reality is that we as a mobile stroke unit have the ability to do an intervention to be able to potentially improve somebody's outcome. Just statistically up here on this screen, you can see that every minute that goes by when somebody is experiencing a stroke, you're losing 1.9 million brain cells. For every hour, that equals 120 million, and per stroke, that's about 1.2 billion brain cells. you can see the effects of a stroke as a result of the loss of those brain cells, the loss of function that exists. Our MSU was in 2018, October of 2018, we began serving the community. You can see that the first MSU was actually in Germany in 2008. They did a study from 2008 to 2012 and said, okay, we know that time is of the essence when it comes to treating strokes because there's a medication that we can give that could alleviate somebody's stroke symptoms, have them have a better outcome. We also know that the faster we get that medication into somebody, the better chance of having a quality outcome, which means either returning to total independence or having an improved outcome, being able to go home and function independently. That's critical, the time element. And what they found was during the study that they did in 2008 to 2012 that the MSU was able to deliver that medication, that thrombolytic, approximately 70 minutes faster than traditional healthcare settings. So that would be things like emergency departments. And that study was presented, and then the first two in the country to go live in 2014 were at Texas Medical Center and Cleveland Clinic. As I said, we were the 13th program in the country here in Rochester. In October of 2018. I've been on the MSU since we started it. I'm the clinical and operations manager of the program. We were at that time 18th in the world. MSUs have expanded. There's now 36 different mobile stroke units in the country that are in existence because people are seeing the advantage of treating somebody sooner for their stroke. Our mission is to provide the earliest possible hyperacute stroke treatment to patients experiencing stroke in the Monroe County region, creating the greatest chance of a complete recovery. This is accomplished by bringing the mobile stroke unit to the patient and providing primary stroke center care on location, in the parking lot they're at the driveway they're on, at their residence, wherever they might be experiencing the stroke symptoms, we come to them. We're bringing the emergency department to the patient. And that allows us to be much more streamlined than traditional care. We have a CT scanner to be able to rule out a bleed versus a ischemic stroke on the ambulance. We have all the medications we need to be able to treat both ischemic and hemorrhagic strokes. And we have a neurologist who joins us on telemedicine to be able to supervise and see what's going on with the patient and write all the orders for the medications we might be able to give to assist that person. Our data tells us that we improve outcomes. Let's put it this way, if we gave, on the MSU, if we gave 100 patients that medication, we would see an improvement in outcome of about 30 or so compared to the hospital. So we're talking a pretty significant number of people that have improved outcomes as a result of being treated with for their stroke earlier in the process. How it's dispatched is we're dispatched through Monroe County to the areas that we're dispatched to. I'm going to tell you right now, Chili is not one of those areas. We do not come to your area as a response. So this is not something that's an opportunity for your citizens at this point in time.
Why is that?
CHS, the ambulance service that you guys use, does not have us into their region. In 2023, they said that they no longer want us to be there. Quite honestly, I think there's a few different reasons. I would be somewhat conjecturing if I were to share all those, but I don't think they're convinced on the science, but I think the science is startlingly clear.
So this is not a town's decision, this is an ambulance service decision? Is that because of the makeup of an ambulance?
I would like to introduce Dr. Bala. He's actually the program director of the mobile stroke unit.
Thanks, Jason.
If you could, sir, could you speak in the microphone, please, introduce yourself?
Thanks. My name's Dr. Bala. I'm an endovascular neurosurgeon at the University of Rochester, and I was previously at the Cleveland Clinic where they launched the second one, so I brought the concept here to Rochester. I think it's important to realize the primary reason we're here is to, one, make the Chili community aware that this is an asset that exists that unfortunately they don't have access to. To your question, whose decision is this? That's a little unclear. That's part of the reason why we're here telling you about this. There's no additional cost to your citizen for this. The University of Rochester foots the entire cost of this. All this is raised through philanthropy. But this is an asset that exists in the community that every single town in Monroe County and then towns outside of Monroe County benefit from, except the towns that are served by CHS.
So, I know there's legalities around the establishment of ambulance districts, and things like that, how they're formed and the certificate of need and all this other stuff that goes on in that. Is that the inhibiting factor?
No, it's actually not. So when we came up with this, we realized is that I don't know how to run an ambulance business. I don't want to be in the business of running an ambulance. I'm a surgeon. I want to take care of patients. I treat stroke. So that's what we're going to do best. We're going to let the ambulance experts take care of the ambulances. So we partnered with the city of Rochester, who contracts with AMR, and AMR runs the ambulance. So they provide the paramedic, they provide the driver. When we first started, there was a concern in the EMS community, especially some of the small mom and pop shops, that are we going to be taking revenue away from them if we have our mobile stroke unit go and respond? We were sensitive to that, and we actually set up a fund that is funded by the hospital that said every interaction you have with the mobile stroke unit, because your ambulance might respond and then lose a transport, we will reimburse you for that potential transport. So there's no revenue lost even to the local ambulance company. The problem is the CHS leadership just doesn't believe the data, or doesn't want to believe the data, or doesn't understand the science, and we have been through it many, many times with them.
It's interesting that you say that they don't come to Chi-Lite. This must have happened before CHS was formed and we started using them, but my neighbor had a stroke just down the street from me, and they came to her driveway and they saved her life with that mobile unit. So I knew they had been here before, so I'm fully aware of.
Yeah, this must have been
how
before
she'd been-
2023. In the
Yeah,
EMS
yeah.
community, they refer to this as the CHS MSU divorce,
Yeah.
because we were explicitly told to not be in the dispatch for the CHS geography.
So in regards to other municipalities, because I'm sure you did your research, what area CHS covers.
Yep.
So out of Monroe County, the other ambulances, whether it's private or the fire departments or what have you, how many other areas do you cover then within Monroe County?
All of them,
Except
except
It-
CHS.
Caledonia, Mumford.
Well, I was going to ask you, so what towns do you not go into right now in Monroe
In Monroe County,
County?
Chi-Li, Henrietta, and
Parts of Churchville, whatever.
Caledonia, Mumford.
Well, that's what I want, you see, if I want them to, yeah,
Sorry.
yeah.
yeah, whatever
So-
CHS covers.
So you're not fully aware of them, what area they cover then, or?
The way that the way that the dispatches work
Right.
outside of inside the Monroe County EMS system is that when somebody calls in and they sound like they're having a stroke, a regular ambulance and the mobile stroke unit are dispatched at the same time based on where the patient is.
Okay,
Now, in the CHS geography,
Right.
the mobile stroke unit is not included to be dispatched.
and that is up to the 911 dispatcher?
Yeah.
To make that determination?
But that is influenced by the individual agencies.
Correct. So my point is then, so you're relying on 911 to actually, during the chaotic situation that you're in, to realize where they're going to be going, who's going to be responding and so forth?
Correct.
To a degree, yes.
Okay.
I
So
mean,
has there been instances where you have been responding to an area that is in that area that you shouldn't be in?
So
I don't like using that term, shouldn't be in,
Sure.
because we're all here about the people.
Yeah.
Yes, exactly. So what happens in those scenarios, because I work on the ambulance all the time, is that there are occasions where it'll get over to us.
Right.
That it's a Henrietta call. I haven't heard of a Chi-Lite call this way, but as soon as it gets dropped on us, we sometimes do get dispatched, but then they will cancel us immediately, even if we do get dispatched. So most of the time, that's filtered out and we're never dispatched.
Right.
But you're absolutely right. There has been a time or two, not often, but it does happen where we actually get dispatched initially, and then before they're even probably out of their house, their bunkhouse, they're already canceled us, saying we don't want the energy.
Where are you stationed out of?
So right now, we post out of AMR headquarters, right there on Chi-Lite Ave, right off of, on West Ave, in the city. Honestly, from here, we're actually probably about 10 to 15 minutes away from any of your calls.
So have you had any community that's served by CHS request a change, or has anyone changed the situation, or it's still stayed the same since CHS is servicing?
So you're the second community that we are here talking to about the
Okay.
services we offer. The first one was Henrietta,
Okay.
which we were at. And that meeting was attended by CHS leadership at the same time. And, a lot of information was inputted from both sides. but we haven't heard feedback from Henrietta yet.
Okay.
So you said, I just want to go back to the comment you made, that you say that you're closer than CHS would be.
Potentially.
Well, that's why I would say potentially, because
So-
then I would just say, how many units do you have? One. Now, if that unit is tied up, then you don't know that's just an assumption. So I want to be careful with assumptions and facts.
For sure.
So you really don't know that you would be closer then.
So
So
let's-
I just want, I'm playing devil's advocate.
Yeah, so
So-
in reality, though,
Right.
we do not want to be on scene first.
No. Well, in reality, we don't want anybody to have to go to a call, but,
Well, right,
Yeah.
but what's,
I mean, we don't want calls.
what works
Right.
best for us
Right.
is that the primary ambulance agency goes along.
Right,
And they're oftentimes, because of geography.
Right.
They're closer. They do an assessment. They determine that person that they think they're having a stroke or not. We get on scene. They give us the information that they have. We do a quick look at the patient, confirm what they're seeing,
Mm-hmm.
bring them onto our ambulance, do the CT scan right there. So think about what we're taking out. All that transport time, all the milieu of a congested ED.
Mm-hmm.
Right? We got one patient with 4 people on the ambulance, saving lives.
Right.
Quite frankly, in your community, pretty historically. And that's one story of, many that we have. But that's how it kind of works the best. So they're always dispatching that local ambulance along with us.
yeah. Well, a disclaimer, my mother had a stroke, and then she actually died in the hospital when they did the surgery, and they released the valve of the blood, and it shot up to her brain, so that's when she passed. So I'm very familiar with the stroke, the process, the therapy, visiting her in the hospital, and just seeing what she was going through. So I understand. You mentioned the medication. Before, David asked a question about it. Was there more that you were going to do as far as a presentation? More things you were going to talk about?
I mean, I would rather spend time talking about the nuts and bolts than going over some of the flaws, if that's what
If I could.
Well, but it's not so much flaws, it's educating us, because you're coming in, you're making statements, so we just, go ahead.
I know there's a lot of questions, and that's fine.
Yeah.
But I would, to address the previous conversation between why they're not coming to Chi-Li, I'll say to the board and to you folks also that I'm going to reach out to Steve Schultz over in Henrietta and see what his take is on everything and why. And then I also.
From a town standpoint.
Yes.
Right.
And I will also reach out to CHS to meet with them to understand more of what their objections are.
Sure.
And what stands in their way.
Right.
Just for your sake, I'll do that.
That's fine, but
And
if-
try and get that sometime next week, and I'll keep you posted on
And we have much more robust data, just so you know.
Okay.
That if we were in another venue or a more appropriate venue, that we could share directly with you guys in regard to our actual data. I mean, our study data.
So I want to be clear about one thing, is no matter who you talk to, the science is unequivocal, is that the data speaks for itself. It has come not only from Rochester, it has come from multiple cities across the country and the world, and has been published in reputable journals and has been vetted. So the science is without a question that says that this benefits people who have strokes. The issue that comes in is never the science or the data. The issue, in my opinion, always becomes around interpersonal relationships. I suspect that there were probably some interactions among EMS agencies that may have led to CHS's decision. And what I would say is that shouldn't be allowed to necessarily influence a negative impact on the entire community of Chi-Li or the entire community of Henrietta. But that's what's happening right now. That's the primary reason we're here, so to talk to you.
And that's truly what it sounds like. It's more of a
Power stroke.
little power
Did I say
struggle
that
and
out loud?
a little identity and a little territorial issues.
Yes.
Which, again, I will try to get to the bottom of it the best I can and report back to you guys on that.
So if all the towns that are serviced by CHS were to get together and demand that your unit service our areas, that could carry some weight?
I would hope so.
I would hope so, too.
Well,
We also
we
provide
won't-
some funds to the ambulance. I would hope that.
We won't necessarily get into our options, but
Yeah.
this is a contract. They're a company, they're a corporation, and we contract with them, so.
And one of the things that they always say is.
We have lawyers to handle
Henrietta's so
contract
close to
issues.
the hospital.
So
In
Let me
Shiloh or
talk about
Scottsdale,
that,
that's not
right?
the case.
One of the things that the EMS agencies used to say when we first got into launching the mobile stroke unit in 2018, 2019 is, we're so close. I mean, Brighton is literally right next to Strong Memorial Hospital. Greece and Irondequoit are right next to RGH, right? And the one point I want to make is we are system agnostic. If a patient gets their care at RGH, we will take them there. If a patient gets their care at Strong, we will take them there, right? We don't care where the patient goes. This isn't about sort of a power grab with respect to patient care, number one. Two, even in Brighton, right, which is minutes away from the Strong ED, we save tremendous amount of time. The reason for that is that everything the emergency room can do, we can do in your driveway. And when you're a patient being treated by the mobile stroke unit, it's more than just the transport time. When you get to the emergency room, you're battling against the 500 other patients that are competing for the same resources that you need or your loved one needs. When you're a patient in the mobile stroke unit, you are the only patient in that emergency room. That's what makes the difference.
Yeah, I think so.
I'd be very interested with the supervisor's feedback from his discussions, because I just can't wrap my head around that CHS is not losing any money,
This is
losing any billing.
This is not a question around funding.
I just can't.
We don't charge for our services. The patients don't get an extra bill. There's not a invoice that's generated by us at all.
Really appreciate you guys coming in with this information tonight. Absolutely.
One thing, there's a couple of questions or comments that I had. You mentioned the ambulance and carrying medication. So the CHS or any other ambulance agency, they don't carry that type of medicine? They're not certified to administer
They
it?
can't because, well, it's not about being certified to administer it. It's that in order to administer it, you need certain pieces of information. So for example, when somebody has a heart attack, right, they tell you they're having chest pain, they clutch their chest, you can put EKG leads on them, and you can detect, even in an ambulance, an EKG monitor, that they're having a heart attack. When somebody has a stroke, there are so many other reasons for somebody to be weak or somebody to have those same symptoms.
These drops.
And if somebody has a bleed in their head, the last thing you want to do is give them a clot-busting medication. So that's why the CAT scanner becomes the decision point. And the CAT scanner exists in the mobile stroke unit, and that medication can really only be given under the supervision of a physician, which is connected through telemedicine inside the mobile stroke unit.
So you were showing slides with numbers and so forth. You talked about brain cells. How many are lost? How many does a normal person have?
Trillions.
Right.
But
So, I mean, just to see those numbers, because you're talking about what you lose, but how many do you have? I mean, but you didn't do a study on me, and they're gonna tell you that I have less than that. See, that was a softball I tossed to them.
We'll just leave that one alone for
Leave
now.
that one,
Real
yeah.
estate, right? When it comes to which brain cells are being impacted, how many deficits they have.
I can't afford to lose money.
So this operates only from 7:30 a.m. to 5:30 p.m., so anything after 5:30 p.m.
Standard of care.
It's the standard of care.
Standard ambulance.
So anybody that happens it in the evening or early morning?
yeah, and the reason for that really is when we launched this, we actually geolocated and also looked at the timings of all the calls that were coming out of Rochester and Monroe County. And it turns out that between 7:30 a.m. and 5:30 p.m., I mean, I'd like to run this 24/7, right? But you have to look at where you're going to put your resources and what the benefit is going to be in expending those resources. So between 7:30 and about 5:30, we can capture about 75% of all strokes that are happening in any of those hours. The other-
AMR operates 7 days a week, 24 hours a day, 365 days a year, correct?
Correct.
And you're running this, basically operating this, correct?
We are 7 days a week, 7:30 a.m. to 5:30.
No, I'm saying AMR as
Yep.
an ambulance service.
Yep.
Operates 24 hours a day, 7 days a week, 365 days a year, correct?
That's correct.
But this unit is not.
I understand that.
No, right, I see where you're going.
My point is that, and I don't, you have the numbers, you know the statistics better than I, but my question would certainly come into that if you're already staffed and operating those hours, why wouldn't you be able to extend to a 24-hour operation?
It's a cost issue and a staffing issue.
Cost
The
issue,
people
if-
that, the
If it
people,
goes nowhere,
what do you
if
mean?
it goes, it's a staffing issue I get.
Yep.
Might be trained personnel perhaps.
That's what it is, right? I mean, the people
Oh.
that are on the mobile stroke unit, their only job, their only expertise is to treat stroke.
Oh.
So this is like the Navy SEALs of stroke.
They specialize this. It's a
That's it.
specialty.
They don't
Okay.
treat heart attacks. They don't treat anything else. They don't treat shortness of breath. They don't treat drug overdoses. I mean, they will if they get out there and they encounter that's what it is, because, they're EMS, but their only job is to treat stroke. So they are so tuned into stroke that in order to actually train somebody, I need 9 to 12 months to train somebody in order for me to feel confident that I'm going to put somebody on the ambulance.
Okay.
Yeah, and I just, when you hear case studies from here or out in other areas, I get a little concerned with that because, I'm sure there's training requirements that have to be met, but then also when you get out to some of these areas, rural areas, they may not have the same, maybe, I don't want to say background or what have you, but I just like comparing apples to apples. I was just out in a rural area, and you look at how far it is for a response from an ambulance, and then who may be available. As you probably familiar with the volunteer fire departments. The lack of people volunteering now because of whatever reasons, it may be personal, professional, family issues. They're having a hard time filling those spots.
It's a challenge.
So with the EMS field, that is, a specialty, and then just having those same people, volunteer. It's a few, 5% of the people that want to volunteer to help out. So whether it's at church, whether it's in a whatever, not-for-profit, what have you. So I'm cautious when I try to compare something to, an outlying area, with that has a population of 5,000 compared to Child we're 30,000. So.
Yeah, I mean, so even for those rural areas, one of the services we provide is something that we'll do called a rendezvous. So if somebody, out in one of these rural areas
Right.
has a stroke,
Meet you halfway.
we'll meet you halfway. We'll meet you in Home Depot, Walmart, Park and Ride, wherever it
Is
is.
that a paid advertisement?
No, not at all.
So, but I think also from the standpoint of if your unit is tied up and, you only have one in this area because you go outside of Monroe County, correct?
Yep.
So then you're going to be relying on those ambulance agencies to do whatever they can with the resources they have available.
Absolutely. That's why I think it needs to be a partnership.
Right.
Right? I mean, that's what we've advocated from day one.
Right. And that's our goal. We want to look out for our constituents, the people that live in our community. We care about them. And that's why, everybody should come together and, and see what we can do to work things out. But
I mean, I
Pretty
think
much
from,
destroyed your presentation now?
you want to finish any of the slides?
Let me so the statistic is 70 minutes sooner.
Yeah.
That's the comparison. And 70 minutes is a lot of brain cells.
Oh, yeah.
Over 120
Yeah.
million. It's the difference between somebody walking out of the hospital and going to one of the skilled nursing facilities, or even a worse outcome than that.
where's that stat from? Is that from Monroe County area or is it
From our data, yes.
from your data from where? Where did you collect that?
So we have data that shows us compared to Strong. We have data that shows us compared to the region. We have data that shows multiple MSUs with their other hospitals that they go to.
See, I'm cautious with that too, because now, getting back to my last point, was I said you have one unit. And if that unit's tied up,
That's
then,
the standard of care,
yes,
which is taken to the hospital.
I'd
right.
still rather see them have one unit.
No, I understand that. I'm understanding, but I'm just looking at, I look at the data. And then,
Do you also still go to senior living centers or any of those?
Yeah.
You'd like the Parklands or Chi-Lite, if you
We
were
get
servicing?
dispatched to those.
You do those? Okay.
okay. I don't like, I just like, I don't want, it's not that I want to question you, I just like playing devil's advocate. Where are you getting these numbers and how did you compile that?
So these numbers are actually patients we've treated, and these are patients compared to either they get stroke treatment in the hospital, meaning get brought in by regular ambulance.
Correct.
Or these are patients that get treated by our mobile stroke unit. The other place that we've done the comparison is the CHS geography since 2023. The CHS geography has served as a great control because that geography has not had the benefit of mobile stroke. That has had just the standard of care, which is regular ambulance. And when we look at the numbers, we're 70 minutes faster in terms of delivering the thrombolytic and the drug if that patient qualifies.
So in a sense, this could be a sort of, I don't want to say slam against the hospitals for not getting that person in there sooner and diagnosing it, or,
Listen, you're absolutely right. The hospital emergency rooms are a mess. Right?
believe me, I know.
And
I know.
I, as a physician, would never want myself or my loved one to be a patient in an emergency room because it's chaotic, and you're competing again against the resources of all other patients for
Right.
what you need.
And you
Right.
could sit for hours, been there, you could sit for hours.
Yeah. The nice thing about this is the emergency room on wheels. It's going to come to your house and your driveway.
Yeah, the level of care. Keep going with the numbers.
Is there any-
Okay. Oh, questions?
Oh, well, let me look. No, go ahead.
This is, I mean, that's really ultimately what it is. It's not saying that, you know, 'cause when we're not in service, right, or, you know, for whatever reason, an ambulance takes a patient to the hospital, they're getting thrombolytic, right? They're not getting treatment. What we do is we do it much faster, and that's practically seen in the outcomes that we see.
But I think what that says is it's not about the transport. It's independent of how far you live from the hospital. Right? The bottleneck isn't necessarily the EMS agency. Right? They're doing the best that they can. When they get on scene, they get the patient in the rig, and they take them to wherever it is the patient needs to go. I think it's an issue with our healthcare system in this country, is that the expectation has been the now. I want it now. I want it, immediately.
Yesterday.
And there's lack of primary care, so people are showing up in the emergency room with all sorts of things. The drug overdose epidemic has been just crazy for emergency rooms. The post-pandemic labor shortage in the emergency rooms has really brought that out to light. So nobody's pointing a finger at local EMS and saying they're too slow. I think it's a healthcare issue in general, but now we have a tool to actually bypass all of that.
Jason, we have your contact information, I assume, is that correct?
I believe that I just have,
Well, if we don't, can we get it, please?
Because this is your baby, right? I mean, so.
Well, both of yours. I don't know who the father is.
I would like to be able to perhaps follow up, obviously, with both agencies on this and see what we
Just
can.
have one more question. Do you have any plans to add any more units?
So it turns out that for about 1 million to 1.5 million people, I mean, there are cities in the United States that are much larger than Rochester. We're actually a little blessed to have a unit like this in
Okay.
Rochester, given the cost. And Houston has 3, for example, that are running. New York City initially had 3. Long Island has 5. Los Angeles has 2. They have different issues, different cities, different geographies, different traffic patterns and everything. Here, in about 1 million to 1.5 million people, we're very similar to a city like Cleveland. Cleveland's a little bit
Right.
larger, and they get along fine with 1.
With one, okay.
Ours has been a little bit long in the tooth. The average lifespan of this is probably about 7 or 8 years. We launched in 2018. We're about at 7 years, so we're starting to see some wear and tear. So we just ordered a second unit that's not going to run concurrently. We'll just alternate which one is in service at any given time so that we can stretch out the wear and tear on both of those units.
Okay.
How is this funded?
So the initial unit was funded through philanthropy. There was a donor who bought into the vision for the community and picked up the capital cost, and then the hospital picks up the operational cost.
Interesting. And so you looked at, you say Rochester's blessed from that standpoint. What's in Syracuse? What's in Buffalo?
This is the only one in upstate New York.
In upstate New York. Interesting. And how did it become, it was because of that individual that donated here? Is that why it started, or why did it start?
I got here in about 2015, and this was sort of part of my pitch to the university in a way to sort of build a stroke
Right.
program. Stroke in here in 2015 was a mess. There was no rhyme or reason about where patients were going. Patients that were having strokes upstate in rural New York were dying. So we needed to sort of coalesce around EMS, coalesce around helicopter systems,
Right.
and to sort of figure out where do we get the right patient to the right place the first time. Patients were going to hospitals that couldn't do anything for them, waiting there for 3 hours, and then getting transferred, which is a mess in itself.
Anything else? Thank you very much for
very
your
much.
time, appreciate it.
Good job.
And
Can you sterilize that, please? No, just kidding.
you're likely going to be hearing from me, so,
Thank you.
all right.
Look forward to, just again, any part of discussions, we'd be more than willing to come out and even show more deeper dive. Because I think it might get that way.
I would implore you to not only reach out to the town officials for CHS geographies, but to the towns that are actually experiencing this, right? Talk to the other towns that we serve. We serve,
Town of, did you serve the town of Gates?
Yes.
yes, we do.
Okay.
You could talk to Cosmo.
So interesting from that standpoint, being their neighbor. So,
Greece, Irondequoit, Fairport, Parrington, Pittsburgh, Brighton, all those towns on the east
I
side.
thought CHS went to Greece.
Not anymore, Monroe does.
Monroe handles that now?
Monroe Ambulance. And we've got a great relationship with Monroe Ambulance.
He would know. He would know.
Yeah, yeah, but that's why, well, that's why I was asking you what municipalities you guys go to. So that's why I wasn't sure all the area, because you said portions, you know.
Well, Churchville, yeah, I think there's a dividing line. I don't know exactly how that looks.
Right.
That's my understanding, maybe not. Maybe Churchville's entirely CHS, but I'm not 100% sure of that.
Yeah, either am I. So, but thank you for your time, thank you for the knowledge and
Thank
background.
you very much.
So I appreciate it.
Appreciate it.
Thank you, Dr. Bala, thank you. All right. Now, I hope I don't have a stroke. Moving
Do you have a do not resuscitate order?
moving right along.
Public forum.
Yeah, we do have a public forum. Anyone wishing to speak at the public forum, please step forward, state your name and address for the record, and you shall be heard. Seeing no one.
Last one standing, no?
Is here.
Okay.
Other matters of the supervisor, I think you'll all be pleased that you should have seen. Archer Road has started. They're starting first with the retention ponds to take care of all the rain that we've been getting and make sure that there's no
Are they overflowing?
drainage issues on
You're
site.
gonna dry by my house.
And they're actually pushing sand around, I think, right now, so. And also, there's been some, they've started some work on the Paul Road sidewalk.
Yep.
That's going along.
Which Paul Road, David?
The bigger Paul Road sidewalk, the northern.
Or the
yeah,
western?
The northwestern section.
Yeah.
Of Paul Road. The other section there, we're probably going to be a little later in the year before we can get started on that one. Yeah. Other than that, no, I don't think I have anything else. Council?
Go on, Mayor.
I just have one thing. If you hadn't heard or hadn't seen it, this is more for the public's sake, not yours, because we all know that Jeff Baker retired from the Charlotte Public Library after so many years of service, and he did a fantastic job. I'm a little biased, I'm the library liaison, but I get to see it firsthand, and he literally did a great job. And to his credit, he has trained Jennifer Loudon, and she has worked side by side with him for several years and has taken over and appointed as the new library director. So I just want to congratulate both of them. We're very fortunate in the Chi-Li to have such a great library and such great employees that work there too, so.
Excellent.
David, one question I had, and we discussed this a few town board meetings ago, in regards to people coming in, obtaining a CDL, and then moving on. Has there been any update on that?
No.
Okay, just,
No, one of the things I've discussed with Dan mostly at this point, because this stuff can become budgetary issues, is we do go into contract negotiations next year. Hopefully, we're going to start early and get them out of the way early. But that will be something that we'll discuss with Dan, David Lindsay, Adam, and myself. We'll have some time, probably early next year, and look a little bit more into what we can and can't do. Of course, we'll obviously have to involve legal on that too.
correct.
I know there's places that do that basically, you spend money training somebody, you commit to a certain period of time that you're going to stay employed with them, and if you don't, then you pay them back the money. I know other places do that. I don't know that.
Correct.
If any municipalities do that.
Right.
I don't know that answer, but we will, early next year, we'll start working on
No,
that.
because I think that's important, that we do pursue that, because it is costing the town money, and then, from the training, and then just from the rehiring process, and it takes away from the highway superintendent or whoever staff it is that has to go through the interview process, and,
Everybody has to work harder, so.
right. Then secondly, I just want to mention, a few months ago, I had the opportunity to walk with you, David Lindsay, Adam, and Tony Sloan, Adam Cummings, in regards to Memorial Park and some improvements. So I know that you've been working on that. I appreciate that. I think that there's ways that we can improve the park, but also make it more safer. That is critical, so I just want to say thank you to you guys for doing it behind the scenes.
You may not have seen the email yet, because I know you were busy, but there are two resolutions on this evening's agenda for your consideration for a grant that we've applied for.
I did see that.
That will help a
Yes.
lot with what we discussed.
Right.
We won't get exactly what we did, but it will If we're successful in the grant and things work out from a financial standpoint, it would be a great improvement to the
Absolutely.
concerns that you had and were brought to us and things that we reviewed at that meeting. So I think there's a good tentative plan in place, but some of it's going to depend on funding at this time. We'd like to see where that goes
Right.
before we look at anything else at this time.
But I think it's important that we get recognized for what you're doing, because there was an issue that was brought up. You know, we brought it in, we listened to the community, to their concerns, and then we're pursuing every avenue that we can. You know, if we can get grant money, that's great, to bring some of their tax dollars back into this community. So, but whatever we can do, it's going to benefit them. So,
I don't think I've ever found a time when this board wanted to do anything but try to improve things for our residents.
Absolutely.
Those people, even non-residents, who
Right.
use our facilities and our parks and things like that. So, I think, this board has done a great job with that, and through the cooperation of a lot of other people here in the town, too.
Right.
So, but
Thank you.
we'll stay on top of it.
no, but I just want to make sure that's mentioned and that people are looking into things. And
Anything else? Okay. We do have the approval of minutes from the last meeting. Also, several reports were submitted under correspondence. The town of Chili has received notification from Jessica Boss. The Highway Department has resigned effective July 31st. Also received notification that, I'm not even going there. You can read it if you'd like. Highway Department has resigned effective August 4th. Go ahead, David. What is it? Mihailo? Okay. And, yeah, the hardest one here to deal with right now is that the building department is losing a great employee, Danielle Saccarelli, who was our planning clerk. She's resigning as of August 15th, but she's moving on to better opportunities in the town, having been poached by the highway department.
so not only do we lose employees to other municipalities, we're losing it from departments.
Oh, they're taking it from within now. So,
it to
yeah,
ourselves.
we did consider a contract that other employees will have to sign, if we train them in something. But I want to, first of all, Danielle's here, so I just want to thank you for, your work in the building department. It's been a pleasure working with you every day, seeing you every day. Always a smile, always a good morning, always very pleasant to be around. I know you will bring the best over to Mr. Lindsay and his team over there, but we're not going to probably see you anymore, It's it, unless they put you in a plow truck or get you plowing sidewalks over here, which,
Just
the
have
rate,
more
at the rate we lose people on highway, that may happen, so.
Do you have your CDL? No, just kidding.
Anyways, moving right along. Resolution 172, Library Board of Trustees. Moved by Councilwoman Spare, second by Councilman DeCory. Questions or comments? Roll call, please.
Councilman DeCory?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 5-0. Resolution 173, Recreation Department.
Moved.
Moved by Councilman DeCory,
Second.
second by Councilman Slattery. Questions or comments? I'd just like to say congratulations to Adam. This is well-deserved promotion for him.
Absolutely. Yep, it
He's
is.
served the town very, very well over the years, and much appreciate what he's done for us. So, any other questions or comments? Roll call, please.
Councilman DeCory?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes, I said 5 before.
I'm sorry,
I
that's right,
stand
it's 4.
corrected, 4, nothing.
Thanks, Council.
4 in favor. Thank you, yeah. Jared would have caught that, So would have Jessica. So would have Matt.
Wait a minute, to
But-
give you a little bit of a
We'll cut you a little
chance to
slack this
correct
time,
yourself,
Jeff.
so,
One
yeah.
more resolution, it was over, right?
Right.
That was it.
Resolution 174, Department of Public Works Highway Department Office.
Well, I don't know.
Moved by Councilman DeCory, seconded by Councilwoman Spare. Questions or comments?
We got
Roll
you.
call, please.
Councilman DeCory?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 175, Building Department.
Move.
Moved by Councilman Slattery,
Second.
seconded by Councilman DeCory. Questions or comments? Roll call, please.
Councilman DeCory?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 176, Assessor's Office.
Move.
Second.
Moved by Councilman Slattery, seconded by Councilwoman Spare. Questions or comments? Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slatter?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 177, Clifton Fire Department active list.
Moved.
Moved by Councilman Slattery, seconded by Councilwoman Spare. Questions or comments? Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slatter?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 178, Special Planning Board Meeting Refund.
Moved.
Moved by Councilman DeCoury,
Second.
seconded by Councilman Slattery. Questions or comments?
David, will this affect, I know there was a timing issue that they had, the company, in regards to the process. Will that affect that at all, not having that special meeting?
No, because they came before Planning Board last night.
They did last night, so they were able to,
They got their final approvals last night. This refund was based on because there's a $1,000 payment for a special meeting for Planning Board. This refund represents the balance owed, because we already put in a public notice and things like that in the paper, so we covered our costs.
Our cost.
And given them the remainder of what didn't cost us anything.
and they're still looking to go before zoning board, I believe, or,
Yeah, go to
2 weeks.
Zoning Board in a couple weeks.
so, but that will not affect this for their approval
That's correct. It
process?
has nothing to do with
No,
it.
but I'm just saying their approval process, because I know they talked about having time limitations
Yeah.
in the past.
Well, those don't appear to be accurate.
Oh, yeah. Well, that's where I was going with this,
Yes,
so
yes. Being done by August was not necessarily,
if you
before August was not necessarily accurate.
go back and you read the planning board meeting minutes and the zoning board meeting minutes, you would see how this has been mentioned, so.
Yeah, any other questions or comments? Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slatter?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 179, 2025 budget amendments.
Moved.
By Councilwoman Spare,
Second.
second by Councilman DeCoury. Questions or comments? Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slatter?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 180, use of Park and Recreation Reserve tables and chairs.
Move.
Moved by
Second.
Councilman Slattery, seconded by Councilwoman Spare. Questions or comments?
I do have a comment. We're talking about Union Station Park, they use that facility as a voting location, and during the primary, it's now where I vote, and during the primary, it was 90 degrees out, and there were only 2 fans in the entire building, and it was very, very hot in there, and those people were there all day. Is it possible to consider adding air conditioning to the lodge? It's budget, I bring it up because we're in the process of talking about budget, so.
It's something that I guess I would, now that Mr. Lindsay's heard this, that request, I guess I would look at that at our budget workshops in September.
Yep.
If you'd like to bring it up at that point for the discussion.
Sure.
It'll give him a little bit of time to prepare.
Can we modify the budget that you're about to present to us?
I'm not, you've already got it. You've been presented.
Presented.
No, I haven't.
Any other questions or comments?
There's no bow on it.
Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 181, use of assessment reserve imagery software subscription.
Moved.
Moved by Councilman DeCoury.
Second.
Second, Councilwoman Spare. Questions or comments? Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 182, purchase of leaf machine replacement.
Second, moved.
Moved by Councilman Slattery,
Second.
second by Councilman DeCoury. Questions or comments?
I heard Mary breathe or something.
Roll call,
Coughing, I
please.
said I better speak up.
Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 183, project support, seeker classification, and designating lead agency status for Memorial Park improvements and New York Bricks grant application.
Moved.
Second.
Moved by Councilman Slattery, second by Councilwoman Spare. Questions or comments? Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 184, seeker determination under the State Environmental Quality Review Act relating to Memorial Park improvements.
Moved.
Moved by Councilwoman Spare, second by Councilman DeCoury. Questions or comments? Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 185, acceptance of non-point source planning grant from the New York State Department of Environmental Conservation authorized engineering service agreement with Lou Engineers.
Move.
Moved by Councilman Slattery,
Second.
second by Councilwoman Spare. Any questions or comments? Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 4-0. Resolution 186, August 6, 2025, abstract.
Move.
Moved by Councilman DeCoury,
Second.
second by Councilman Slattery. Questions or comments? Roll call, please.
Councilman DeCoury?
Aye.
Councilwoman Spare?
Aye.
Councilman Slattery?
Aye.
Supervisor Dunning?
Aye, passes 4-0. The next meeting of the Charlottetown Board will be having its budget workshops on September 3rd at 5 p.m. in this room. The next regular meeting of the Charlottetown Board will be September 10th at 7 p.m. This meeting is adjourned.